have that incredible laser, number one.
Hey,
Number two, for periodontal, for gum treatment,
right.
is implants. This laser can clean those failing implants and regenerate bone.
Good. Dr. Sawyer, let's talk about improvement and things which have gotten high tech and how high tech has improved and does currently improve faster than anything else ever our lives. And some people, certain things are maybe not always an improvement, but they change. And I think from talking to you and to other medical professionals, dentistry is not bypassed. Basically, even though we talk about artificial intelligence and about self-driving cars and etc., and we probably not yet talk about self treating dentists, like like going to a dentist with a robot. We're not yet talking about that, but 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 we are having tremendous advances in dentistry as well, which is enormously good for the patient. And you mentioned something about laser. Give me the 2, 3, or 5, whatever you think, how many major points there are with which laser currently help people, and tell them to me in a very short bulletin point way, because we'll get into it afterwards in point by point to explain, because it's worth it.
Yes, absolutely. The technology is amazing and mind blowing. It develops very fast. We have that incredible laser. Number one, I think it's we can do fillings and other uh, treat cavities with no anesthesia. So imagine no needle needed at all. So it's cavity treatment. Yes, yes.
That
So
is great.
for kids, for petrified patients, a lot of
For
people,
everybody. I mean, who
everybody.
the hell likes a needle except some junkies? And even they don't like it. I think they just
No
like the
one
end.
likes needles. So no needle dentistry. Let's put it this way. Number one.
Okay.
Number two, for periodontal, for gum treatment, you don't need cut your gums anymore. No cutting. It just treats the gum with laser energy of light and warmth. So it's disinfect and it's repairs the bone. It restores the bone back. It's unheard of because we can clean, but we cannot regenerate bone. So this laser capable of regeneration of the bone for the gum treatments. Number
It's
three,
more than incredible. This is magical.
it is
So
magic.
you were telling, just to I know I said just give me the point, but I'm dumbfounded. So you were telling me that when you have receding gums and your gums get all bleeding and small, and you start seeing the roots of your teeth, and you start looking ugly, and they start getting, you can actually fix that with a laser instead of going in it with a scalpel and scraping out the infection and sewing it together
And then you heal 2 weeks. So it's the lasers skip the step of healing of inflammation. So there is no post-operative pain. There is no 2 weeks healing. You can get up from the chair, you go to work, go out with your friends. You own your life basically. Plus, you get treatment. You get
and even the bones get rebuilt.
regenerated. Yes.
Unbelievable. Unbelievable. Number 3, sorry to interrupt you.
Number 3 is also implants. There is some implants that were placed many years ago, 10, 20, 15 years ago. And sometimes those implants losing bone.
Good to know that they hold that long, though. Good to know that they hold that long.
Yes, yes. Implants is a great option with the right patient selection. This laser can clean those failing implants and regenerate bone and save those implants instead of removing them and doing new implants. So you can save money, time, and absolute aggravation on healing process. And another beauty of this laser that it's two machines in one, two worlds, medical and dental, on one machine. There is concept of snoring and sleep apnea. A lot of patients suffering from not sleeping well at night, or even if you sleep at night, it's not restful and it's not deep enough sleep. So it's called sleep apnea. So laser treats sleep apnea with no cutting and no ablating. It just shrinks the soft tissue on a molecular level. After 3-4 treatments, patients stop snoring. Their spouse or significant other gets much happier because the noise is gone. But the patient itself gets a benefit of very restful sleep. So they sleep well, they wake up very energetic, there is no more coffee needed. They stop getting naps and fall asleep on unintended airness, like during watching TV or at work. A lot of people fall asleep at work.
That is also incredible. Let me ask you something to again, to verify something here. So, first of all, we know that when people have a sleep apnea, basically they get deprived of oxygen because they stop breathing and oxygen stops, which is one of the reasons they wake up
Right.
sleepy and fall asleep next day in the afternoon, and etc. And here is a very, if you don't mind, a very personal question. My wife has had sleep apnea probably forever. My wife has only very recently we found out probably had a eye stroke where a very so she apparently has glaucoma and high eye pressure, like blood pressure, but high eye pressure. Now we fixed all that without medicine actually. And nevertheless, it's like if you cut off my hand, it is cut off. It's a different saying. So let me just ask you, would for instance this type of, because she still does a little bit snore. We found out a few things that she snores less, such as sleeping on the side, because she was in strong belief her whole life she must be sleeping on the back. And then I showed her actually a few videos. I always sleep by nature on the side, right? And so because if I do sleep on the back, like when I just take a nap, I also snore like crazy. Most of us do. And the point is, would this treatment, this laser treatment, actually in some shape and form help my wife, that at least any future deprivation of oxygen could be stopped?
Definitely, yes. So we have a lot of patients like your wife. They tried CPAP machines and they failed, which is considered gold standard. However, it's very little compliance from patient side. So those patients come to us and we treat them with laser. We treat floor of the mouth, tongue, soft tissue, some soft palate, and all those soft tissues shrink on a molecular level after 3, 4. Some patients need 5 treatments of laser, and they stop snoring, and the oxygen level goes up. And because we do it, we do sleep test before. Now they come to us, and then we do after treatment with the laser another sleep test, which shows us the different numbers. So we getting scientific approach to that. Patients are very happy, and the laser doesn't cut anything. It just shrinks soft tissue. A lot of patients who have tonsils, big tonsils that block their airway, also shrink. So tonsillitis goes away, and a lot of patients get sinus problems, which get treated also with the same laser.
So